Yes.
Okay, waiting for everyone to join. Good afternoon or good evening, depending on where you are. I would like to start with a warm welcome to everyone participating in this session of the conference. We have 4 speakers and each will be presenting for 20 minutes. If you have any questions, you may send them in the chat and the speaker will answer them at the end. So basically that's it. So without any further ado, I will introduce our first presentation on COVID-19 and the aggravation of social inequalities for Brazilian women in the labor market, feminization of poverty, international trafficking in women, by Lopes, Placca and Thaís, Duarte, Zappelini. We have also Cláudia, and they're from Mackenzie University in Brazil. You may start, please.
Okay.
You have 20 minutes.
Okay, thank you. I'm gonna share my screen just a minute. It's okay?
Yes, it should be fine. We can see it.
Okay.
Thank you.
Thank you. Okay, so hi everyone. My name is Placca. It's a pleasure to be here in the Global WhatsApp conference, and I'm gonna present this expanded abstract called COVID-19 and the aggravation of social inequality for Brazilian women in the labor market, feminization of poverty, and international trafficking in women. So I wrote this abstract with 2 colleagues. Thaís Duarte Zappelini is gonna also present in a few minutes, and with Cláudia Cardia. So the idea with this paper was to analyze the consequence of COVID-19 for the labor market, considering specifically the Brazilian women in difficult socioeconomic conditions. It's also important to say that the Brazilian Institute of Geography and Statistics notes that women are the most affected group since the pandemic outbreak, and it's known that social inequalities turns people more vulnerable and prone to risk situations in search of survival, such as human traffic. So with this information in mind, we propose to investigate the results that COVID-19 brought to the labor market of Brazilian women, and what are the impacts of it on the increase of vulnerability and consequently on the numbers related to international trafficking in women in the coming years. So our general object is to investigate the impacts from the pandemic in the intensification of vulnerabilities, particularly with regards to Brazilian women in the labor market, and if it can cause impacts in the statistics related to the trafficking women in the following years. And the specifically objectives are to point out the socio-economic factors generated by COVID-19, demonstrate how these factors contribute to increase the difficulties to Brazilian women in the labor market, and infer connections between the growth and victims of trafficking in women and the context analysis. Now, Thaís is gonna continue the presentation, talking about the hypothesis.
All right, thank you so much, Carol. It's very nice to be here with you all today. Can you hear me well?
Yes.
Thank you. And I also would like to say that it's a great pleasure to work with Carol today. We have been working together for many years, so thank you, Carol, and also with Professor Cardia. So in order to continue our presentation, I would like to discuss with you our preliminary hypothesis. So we have two preliminary hypotheses. The first one is that we can verify that impacts of the COVID-19 aggravated social inequalities, specifically when we talk about the labor market of Brazilian women, and when we talk about the intensification of the social inequalities to increase vulnerability in these women with regard to human trafficking. We are working with a second hypothesis, but we are betting on the first one. So in another way, another possibility in view consists in assessing that despite the new structuring, the labor market has observed these women, even though the pandemic context, and that the federal government had a sufficient positive impact, not allowing that the vulnerability of this woman to human trafficking to increase. Thank you. So, in this discussion, in our study, we aim to investigate the impacts of COVID-19 brought to the labor marketing of Brazilian women, and how this feminization of poverty as a result of COVID-19 can affect the number of the victims of trafficked women. Also, when we talk about social inequalities, we need to, when we talk about them, we need to attend that they are intersectional and they accumulate because of various risk situations in search of survival. In this sense, people are subjected to conditions of vulnerability, and it is at that moment that they are constrained to seek means for their survival, as Carol said. And also, in addition, human trafficking is structured on these inequalities to collect their victims, which makes us reflect about this scenario that for a long time is worrying in Brazilian reality, added to the worsening of the feminization of poverty brought about by COVID-19 and the consequences regarding trafficking. So how is our article structured? At first, we aim to investigate the obstacles of the new roles assumed by Brazilian women during the pandemic, and in sequence, it is appreciated which groups of the Brazilian women have suffered the most severe impacts in the labor market with the COVID pandemic. According to the IBGE, the largest proportion of workers away from work due to the social distance are domestic workers, as we know, without formal contract. And also the possibility of remote service is a reality only certain for certain levels of education. As we know, such people with higher education or postgraduate education. And we also know that population with no education or with uncompleted elementary school don't have the possibility of the remote job. This research seeks to make a survey for what possibilities were offered to this group of women and how this labor has been observed so far, if it has been observed at all. Yeah. And finally, considering the impacts that the pandemic had on the job market in question, we move on to the analysis of the worsening of the feminization of poverty and the consequences of this new scenario for international. So thank you very much. Here is our contact. We are
Perfect timing.
At your disposal to any further questions.
Thank you very much. Perfect timing, just on time. So we do have some time for questions, if anyone has any questions. Can't see any questions in here. And
not yet.
Okay, just I'll give it a few seconds, maybe extra 1 minute. And while waiting, if you would like to add anything to your presentation, just feel free to add.
Thank you, Lara. No new points. We are researching. It's just beginning. We have a lot to study and do in this article. And in this moment, it's all we have. We are glad to answer any questions. If you wanna to go to the next presentation, I'm gonna be here at the end. So if some questions,
we can ask the questions
perfect. Thank you very much.
Later. Yes, no problem for me.
Yeah. Perfect. I might have a question if you may answer. So I was just kind of interested because I know Brazil is a very big country. So your study, is it on the whole of Brazil, or is it like just covering specific areas?
I don't know if I understand very well, but you are asking if what women we are gonna study, right? Because Brazil is a very big country, and what's the limited topic in this subject. So we are thinking to study more a specific class of women that are more poor and are facing very high difficulties because of the pandemic. So are a very vulnerable group. I don't know yet the age that we're gonna to probably we're gonna to do some I don't know.
I guess what Carol means is that we are gonna look for the specific age that women go to the labor market, and we are also checking. Our main object is to talk about the vulnerable groups. So as Carol said, the poor women, and to look at these, considering the intersectionality. But we are hoping to use the data from different states. So if we have access to data that can contribute to that, we are going to be glad to compare the situation in various states here in Brazil.
Oh, yes. I see. Perfect. Yes, but, please.
No, the focus is more federal, because the IBGE, this institute, show the data for all the country, for all Brazil. So I don't know if we're gonna focus in some states, specifically states. I really, I don't think so, but it's a good idea, maybe.
Oh, perfect. So I see it's going to be quite representative. Well done. Very interesting talk. Thank you very, very much. And so if you don't have anything to add, I might end this presentation here and move to the next one.
Okay, thank you.
Okay, so thank you very much. And next we have who in your family must die for the progress of the nation. An analysis of Brazilian patriotic propaganda during the COVID-19 pandemic by Rosanne Bezerra de Araújo, Tito Matias from Federal University of Rio Grande do Norte in Brazil. You may start, please.
Rosanne, you are muted. You are muted.
Sorry.
Okay.
Good afternoon.
Yes, we can hear you now.
I apologize for the problem in the beginning. I had to start the computer again, but now everything is sorted out. I apologize again. So I would like to thank the support team, the coordinators and the organizers of this conference for the opportunity of sharing our paper with you. Thank you for having us here. I am Rosanne and Tito is my colleague. We are from different institutions in Brazil. Our field of research is comparative literature, and our present paper is a reflection on COVID-19 and its impacts, especially in Brazilian context. So I will start briefly talking about some considerations about a double disease in Brazil, trying to connect the virus with the virus, I mean, COVID-19, and the virus of ideology, because they are very much intertwined. Then I will expose a very brief global view of COVID-19 scenario according to some writers, guiding to COVID in Brazil precisely, and finally the propaganda. A double dose disease, the double dose disease that I mentioned, COVID plus ideology, has to do with the fact that actually we think Brazil as a country that suffers from not only the virus disease, but also a kind of spiritual or moral or ideological disease. As the Romanian philosopher Constantin Noica, in his book, 6 Maladies of Contemporary Spirit, exposes, life is not healthy. And if we think about the sanity of a planet, or like planet Earth, or the sanity of a nation, the sanity of a body, organism, and then we will see that at present, Brazil is not healthy. Understanding the nation as an organism, as a being that suffers from the symptoms of an illness. And what is Brazil's illness? Well, it is ancient and it goes back to the time of slavery. It goes back centuries ago. And with our current government, we have witnessed this illness stronger. We witness a more racist, conservative, uncritical society. It's quite difficult to characterize the Brazilian profile. I'm saying this based on 2 authors, Laura Carvalho, with her book about virus and the return of the state, and Leonardo Avritzer, who wrote Politics and Anti-Politics in Brazilian Government Crisis, Bolsonaro Crisis. So these 2 books are very recent. They have published this book recently, 2 months ago. So it's a very fresh analysis about the context of pandemic and political context as well. But before we start talking about propaganda in Brazil and pandemic and all these things, let's take a brief look on the context of COVID-19 globally. In her text, Capitalism Has Its Limits, Judith Butler warns us of the strengthening of national policies, the closing of borders, and the danger of the arrival of speculators eager to capitalize on global suffering. According to her, the virus does not discriminate. Social and economic inequality ensures discrimination. Indeed, the capitalist system values the lives of some and despises the lives of others. Similarly, in his essay, Anti-Capitalist Politics in Times of COVID-19, David Harvey claims that the neoliberal model proves every day that its model of fictitious capital accumulation is a farce. The austerity policy of neoliberalism is designed to finance tax cuts and subsidies for big business and the rich, when in fact, they should be raising funds in defense of public health. So this is not happening in some countries, and in Brazil, it's not happening either, because government is not raising funds in defense of public health. What it favors for public health is like the minimum percentage, you see, although it advertises the opposite. So all these authors that I mentioned in the full essay, I'm gonna just try to summarize here. The authors such as Alain Badiou, Slavoj Žižek, Marcus Gabriel, Judith Butler, David Harvey, just to name a few, they see eye to eye with one another, although with different arguments. But all of them seek to reflect on the views on the present and risk hypotheses about the future based on recent controversies about pandemic in different scenarios. Their essays are compiled in a book. The title is Sopa de Wuhan. I have the Spanish version, Sopa de Wuhan. And it is an editorial initiative published this year that took place during quarantine period. So the book brings ideas of authors from different countries with articles and essays highlighting not only considerations about COVID-19, but also the characteristics of a pandemic of class, gender, and race. Regarding Latin America, if we come from a global perspective to a more specific context, Maria Galindo, a critic from Colombia, remarks that even before the new coronavirus, people had to face other strong maladies such as cancer, malnutrition, dengue fever, and other ones. So many people still live in unhealthy areas without basic sanitation or access to water, no access to hospitals or to expensive medicines. COVID-19 has come to add to these evils that already exist. You see, it has come just to add something more. And as Marcus Gabriel, the German critic, highlights, all virologists are seeking to find a vaccine against COVID-19. Of course, it's the goal of everyone to save lives. And then I quote Marcus Gabriel now. But who would listen when we are told that every year more than 200,000 children die from viral diarrhea because they do not have clean water? Why governments do not seem to care about these children? Unfortunately, the answer is clear, because these children are not in Germany, in Spain, in France, or in Italy. It is a provocation. Yes, it is. Marcus Gabriel, with this kind of provocation, he wants to call our attention that the other viruses have always existed, but authorities and government didn't care much about the quantity, the number of deaths, because they didn't stop economy. But now with the pandemic, we have a real economic threat. We are tied to one another. All nations, all continents, all people are chained to the system in order to make it go on, to keep the machinery producing. And that is why all lives seem to matter now. Guiding our discussion to COVID in Brazil with Laura Carvalho and Leonardo Avritza, I have just mentioned, we understand that the pandemic is not democratic, and as some politicians like to make it seem, they make it to seem democratic, but it's not. Both writers, Avritza and Carvalho, carry out research on structural gaps and inequalities in Brazil. And on ideology, we bring the ideas of Slavoj Žižek, specifically in his book, The Parallax View and Welcome to the Desert of the Real, demonstrating different social situations in which we see that the truth is in fact nothing but an illusion. By bringing the term using astronomy, parallax view, Slavoj Žižek expresses his critical thinking. He problematizes his view, this parallax view, which is we never have the right view, the precise view of reality. You see, what we have is a kind of shadow. We have symbolic view, but not the real one. He problematizes this, and we will apply this parallatic view in the Brazilian propaganda at the end of this talk. Well, various words have always come up throughout history in order to build an understanding of the real. Such words, democracy, justice, freedom, human rights, patriotism, all of them and other words, much more, they are semantically unstable and continue to be constantly revised since they are impregnated with their opposite. So they are not ideologically neutral terms. In practice, their meanings do not always correspond to words. Let's take democracy, for instance. The Brazilian government says it is democratic because it does not encourage lockdown in the country. It says that people are free to stay at home or not. The government allows deforestation in the Amazon region, ignores the destruction of its ecosystem, allows the invasion in indigenous lands. So what kind of democracy is this? It's a democracy in reverse. This is what Slavoj Žižek says in his Parallax View book, and also in Welcome to the Desert of the Real, because actually the word becomes empty. Democracy becomes like advertised, but in an empty way, because into practice it does not work. Democracy in reverse is what we have lived in Brazil. And by bringing the theory of parallax view, applying to the Brazilian propaganda, I would like to share with you the slide. I don't know if I don't think I can open the slide. It's just 2 pages, 2 slides, just 2 pages. I sent to the committee.
You are able to share.
Is it possible?
Yeah.
Right. Yes. So there is this propaganda. The propaganda is. I am controlling the time. Okay, people. I am almost.
We are not seeing your screen.
I know.
Choose at the green button.
Sorry, I will. You're not seeing my screen. Share screen. All right. I always use Google Meet in my lessons. That's why I'm not familiarize.
Don't worry.
Okay, so I have to.
Could you find the green
Yes.
button?
Open
Share
system.
screen.
Yes, and then I have to click on desktop, is it?
Yeah.
Yes. Open systems preference. Right. And then. Oh, it's not this one. So. Okay. Just a moment. I can't believe it. It was going so well now because of this.
Don't worry.
Can you see now, people?
Not yet.
No. Maybe not.
If you prefer, you can share an archive in the chat.
I'm opening it. Just a sec.
I can see here, but I don't think, maybe I have to do something in order to share with you. I click on share, but.
Okay, so while waiting until this is sorted, I would just like to remind everyone, if you have any questions, you may send them in the chat.
I am almost finishing. It's just to have the image, because the image makes it clearer, you see, for the ones who are following the presentation.
It's all right, we still have time, no worries.
So are you trying to share, is it? Or did I understand well? Are you trying to share? Yes.
You are
Sharing.
sharing.
We can see now.
I must wait.
You are sharing.
No, it's me, Lara.
Okay, sorry.
So I'm sharing your slide, Rosanne.
Thank you. So you can see this one, right? So we have talked about COVID-19 and ideology, global context, Brazil, according to Laura Carvalho and Leonardo Avritzer, ideology according to Zizek's parallax view. And now we are going to apply exactly his theory in this propaganda. You can see the propaganda, right? With the colors of Brazilian flag, Brazil, hashtag Brazil must not stop. This was a campaign launched by Brazilian government exactly at the moment of the peak of the pandemic, in the end of March, you see. So the campaign sounds criminal because it tries to make a polarization between saving lives or the economy, saying that Brazil must not stop, using the colors of the Brazilian flag, trying to, how can I say, trying to make it more sentimental through patriotism, using the colors of the flag. So the campaign is criminal because it makes the polarization between saving lives or the economy, not only this, but also the polarization between left and right. And this polarization, encouraged by fake news related to COVID-19, minimized its effects. And a great part of the population embraced the government campaign, and some images started being broadcast. So this image generated other images, which was that one here below. In your family, who can die so that economy won't stop? So we have this black poster, but there was another colorful one, one from the left wing, another from the right wing, trying to polarize this campaign. In the second slide, we see an attempt to project
Sorry,
Zizek.
Rosanne, we can see the slides now. We have a technical problem with the Felipe's computer.
All right. So I will just advancing a little bit. So you understood the message. You could see the first one, right? The first slide.
Yes, we could see it.
Yes, the first we can.
Yes, exactly. So the thing I was mentioning about the real and ideology. So the real is always a kind of spectrum. We never know exactly how to reach it because we have access to the symbolic. The symbolic is what? The patriotic propaganda. But the real thing, the core, what is the hidden spectrum, the real that Zizek defends? The core thing is that the government wanted to disguise the attention of people to other things, like to this campaign, in order to mask much stronger problems that were happening in our government, which is corruption, crimes by the family of the president and their supporters. So this polarization was a way of deviating the attention of population to another thing. And according to Zizek, the core of the matter is the thing that we have to search for. We need to focus our critical thinking in order to understand without the lens of ideology. The truth might be that the tension between both observers, observer one, right wing, and observer two, the left wing, the observers of the propaganda, they clash, of course, to one another, but this clash was already predicted by the government because that is the intention, you see, to promote confusion, to promote rebellion, to promote disturbance between both sides. This is how ideology operates. It defects the angle of the observer so that one sees exactly the illusion of the observed fact, when actually the real thing is that by promoting this kind of polarization, Brazilian government ended up promoting more visibility to itself. And to conclude, we believe that Brazil will continue promoting enormous social inequality unless there is a general awakening. The damage caused by the neoliberalism has already contributed to destroy the image of the left wing and promote the extreme right, as we have witnessed. And the line followed by the extreme right has to do with the neoliberal policy. Likewise, such a policy encourages enormous capital flight to rich countries, leaving developing countries in the hands of corrupt policies protected by the conservative, elitist, and nationalist ideal, which blinds a population, a Brazilian population that reads little, informs little, and theorizes itself more and more easily into fake news.
Rosanne,
thank you very much.
Okay,
Thank you very much. Just on time also.
Just on time, right? Could you see the other image, please? No.
Yes.
Yes?
Yeah. It's on the screen.
The triangle?
Yeah, it's in the screen. Can you see it?
Yes, it is an attempt to show this theory of Zizek. You see, the real is always in a spectrum, is something hidden, but then we have the access to the symbolic, which is the patriotic campaign. Thank you very much, and I'm sorry for if I surpass the time.
Thank you very much, Rosanne. You're just on time, but unfortunately, we won't have time for questions. a very interesting talk. We would be very interested in maybe following up on the measures on how you're implementing your findings, and maybe like it's very like more like raising awareness. So we would be waiting for your findings, your final findings. And next we will move to our next presentation. So thank you very much again. Our next presentation is about governmental transparency and the COVID-19 pandemic in Brazil by Nicolas, Addor, and Flávia and Cinthia from Pontifical Catholic University of Paraná. You may start, please. You have 20 minutes.
Okay. Could I share my screen?
Yes, you can share your screen.
Okay, thank you. Good afternoon. My name is Flávia Duque. I speak from the city of Curitiba, state of Paraná in Brazil. It's a pleasure to be here, and it's a big honor for us to contribute in discussions of this panel. The research was done by me, who is a master's student in law at the Pontifical Catholic University of Paraná, by my colleague Nicolas Addor, PhD student at the same institution, and by our advisor Cinthia Freitas. Observing the COVID-19 and its unique impacts, we choose to discuss how the governmental transparency affects the COVID-19 pandemic scenario in Brazil, considering the importance of the right to information and its effectiveness in defining public policies that contribute to facing the pandemic. I will try to summarize how the pandemic started in Brazil and how we are dealing with it. As soon as the World Health Organization announced that we are facing a global health emergency caused by the new coronavirus, the Brazilian government began to prepare for the arrival of the virus in the country, creating laws and adopting measures that solve the prevention of contamination and the structuring of the public health system. It is important to mention that the Brazilian Federal Constitution guarantees in Section 196 that health is a right for all and a duty of the state. The state is responsible for promoting universal and equal access to actions and services for the promotion, protection, and recovery of health, which is part of the Unified Health System, the SUS. However, no public health system in the world would be ready to face a pandemic. The first case of COVID-19 in Brazil was registered on February 26th this year, also the first case recorded in Latin America. In March, COVID-19 had already reached the status of a global pandemic, and in Brazil, it was already possible to identify the occurrence of a community transmission of the virus throughout the national territory. Thereafter, government authorities directed their efforts to mitigate the effects of the pandemic, aiming to prevent serious cases and deaths. In Brazil, the Ministry of Health is the federal institution responsible for the elaboration of public policies related to health. And since the beginning of the pandemic, it has been monitoring the records of suspected, confirmed, recovered, and deaths cases related to COVID-19. These data are obtained through a system called iVice, which is supplied by the state and municipal health departments. These data were released by the Ministry of Health through a website with daily update and consolidated in a weekly bulletin. This allowed the population to have access to information about the evolution of the disease in the country. We had some political changes along the way, and this influenced the conduct of the measures adopted to face the pandemic. After the exchange of two ministers of health during the pandemic period, in June, the Ministry of Health started to restrict the information that was released, presenting only the data related to cases registered in the last 24 hours and hiding the total data accumulated since the beginning of the pandemic. Due to the omission of the federal government, part of the media came together in a collaborative way to collect data about the evolution and total numbers of deaths caused by COVID-19 in the country, through direct consultation with the health departments of the states. After criticism due to the lack of transparency by the federal government regarding the dissemination of information related to the pandemic, the Ministry of Health was forced to republish the data that had been hidden on a daily basis, as determined by the Federal Supreme Court. In addition to these controversies, we currently face other problems that affect access to information and its effectiveness. The instability of the website containing the official data issued by the Ministry of Health, the lack of daily updates, the possibility of underreporting due to the low testing of contagion of the virus, the inconsistency of the data compared between states, cities, and the total number of cases in the country. All of these problems generated insecurity regarding the quality of data, that the media maintained independent data collection, even after the data was republished by the Ministry of Health. The partial, discontinuous, and disorganized disclosure of data related to the COVID-19 pandemic by the Brazilian federal government could generate insecurity regarding to the real situation of COVID-19 in Brazil. Considering that information is fundamental for the definition of adequate public policies to prevent and contain the virus, if we don't have quality of data, it's not possible to say that we are making the best decisions. Thus, the aim of this research is to discuss the role of the Brazilian public authorities in providing data related to the COVID-19 pandemic from the perspective of transparency and the right to information. Now, my colleague Nicolas will talk a little more about our research.
Good afternoon. Thank you, Flávia. It's a pleasure to be here. Our advisor is also here, and it's a pleasure to have this presentation with all together. And so I'm going to talk a little more about the transparency portal in Brazil, that is the coronavirus portal. And the study analyzed whether there's a lack of transparency in Brazil regarding data from coronavirus. So as Flávia has explained here, in the case of the coronavirus portal, a public portal under the supervision of the Ministry of Health in Brazil, the process of updating data on confirmed cases and deaths in Brazil is carried out daily through official information provided by the state health departments. But the Ministry of Health, with all the problems of data in Brazil, gave some justifications for that. So the first justification is because of the plurality of each 5,500 Brazilian cities with different population size and infrastructure and organization of health services. It is possible that there will be changes in the number of cases or deaths due to errors and delay in the transfer of data. And it is also possible that the data for a city is smaller than the previous day because the notification local is not necessarily the same place of residence of the notified case or death. In addition, cases and deaths are predated by notification date. So we have other problems of that. As we know, Brazil is a continental country with 26 states, and with this large proportion of people who have some problems depending on the regions. Regions like North and Northeast face more problems. One of the factors is the high proportion of deaths without medical assistance or with well-defined cause. Such facts require further analysis and affect the epidemic of the system. The case of Brazil is interesting, and the open knowledge Brazil evaluation had some results throughout the year and gave some resolution. What about the data, the transparency here in Brazil? In July, the federal government was in the 20th position with 49 points according to the Transparency Index, classifying it as average transparency compared with other Brazilian states. But now, in November, the federal government was in the 8th position, with 85 points being considered as high index. It is understood there was a huge conflict and disorganization in the dissemination of data in Brazil, but that over time consolidated a more reliable system of information provision. However, in addition to the need for consolidated information in Brazil, there is a need for harmony in the discourse of presidency and other public bodies. For example, the disclosure of data was restricted and at the beginning of the year, as Flávia exposed here. Due to this fact, newspapers in Brazil in July formed a partnership and worked collaboratively to seek necessary information into the states and the federal district. According to them, the conflicted attitudes of the federal government put in doubt the accuracy and the availability of the data. So because of that, we have in Brazil this conflict of data. We have a private data of the coronavirus, a private coronavirus portal that is provided by these newspapers, and we have a public portal that have the other informations or other data of the coronavirus here in Brazil. So this is our research. It is in the beginning of the studies. We are the beginning of the studies, but we would like to thank you the opportunity to present here. And in the future, we are anxious to give to everybody the final results. So thank you.
Thank you very much for this interesting presentation. And right now we are waiting for any questions to come. If you have anything to add, we'd like to hear it from you. Okay, so I see questions coming. Okay, so the first question is, do you believe that the disorganization regarding the data on COVID-19 in Brazil are deliberate?
Let me understand your question. We think that in Brazil, we have a problem about our leadership. What is the problem here? Because of with the centralized government here that we have, although we have states in Brazil and idea of a federal pact, the federal government has leadership in Brazil and a lot of power here. So because of that, some changes in the Ministry of Health or other ministers in Brazil can provoke a huge change in the governance here in Brazil. So because of that, a simple change of a ministry here can affect all the projects that we have here. So this is we face this year, not this year, but in the beginning of the last year in 2019, with the change of the presidency here in Brazil. So we had since 2016 a huge program of transparency in Brazil, and this program was affected here because of this change of governor of presidency here. So I think this problem about this situation in Brazil, about this transparency situation in Brazil, is this organization. It depends of the governance here in Brazil. So if we change the presidency, we have a leader, we have a minister that motivates, that thinks that data in Brazil is necessary to have a good governance. The policies will work. So it depends of the leader, depends of the minister that are on the power at this time. I'm sorry. I think my answer is a little confused, but I can answer more if you need.
Thank you very much. That was quite informative, and I hope he answered your questions, Carolina. Okay, sure. So she's saying thank you. We're waiting for any more questions coming up. We will just give it another minute. So we still have time for some more questions. And I would just like to remind everyone, if you have any question regarding any of the presentations that were today, just feel free to just send them in the chat and we will just raise them immediately. And thank you very much, Nicolas. Meanwhile.
Thank you.
So I do have a question for the second presentation for Rosanne. Are you still with us?
Yes, I am. I'm here.
Are you able to answer a question, please?
Sorry, could you repeat?
There is a question for you, so I'm just going to raise it now. Do you believe that the federal government contributes to political polarization and death resulting from COVID?
Yes, I do believe that our government contributes to the polarization, unfortunately, because that's the main goal, isn't it? Is to divert population's attention to the main thing, the main wrong things that are going on in the government. And they try their best in order to disguise, to mask the reality. And the best way to do this is to provoke confrontations, polarizations. Sorry, could you hear me? I think my screen froze.
Yes, we could hear you. Thank you very much. Okay, so I think, well, probably that would be it. I'm just going to give it another minute to see whether there are any more questions coming up. We were supposed to be, another question. What are the main measures to enforce transparency? And I believe that is a question for the last presenter, Nicolas and Flávia. Thank you very much, Rosanne.
My pleasure.
Thank you. Nicolas and Flávia, is anyone available to answer the question, please?
May I answer? Okay. Can I answer now?
Should I repeat the question?
No. Thank you.
Yes, please.
Thank you. So the main measures to enforce transparency. Well, I think I have a different answer from Flávia compared with Flávia and Cinthia. I think that the private, we have a kind of private solutions that is very interesting to have to enforce transparency. For example, we have some non-governmental organizations here that read the news, read the data that is provided by the government here, and they check if the information there is true. So I think that to motivate, to enforce the transparency in Brazil, we need to have more non-governmental organizations that support the government here, looking for the data, looking for the transparency, and to have a more more people fiscalizing what is happening in the government here. So I think these non-governmental organizations is necessary to enforce our transparency here in Brazil.
Thank you very much. Okay, so I'm just waiting to see if we have any more questions. So we don't have any more questions. And for the last presentation, we don't have any information from the presenters. So we may end the session here. I would just like to thank everyone for attending, for participating, and a big thank you, the warm thank you for the speakers, for presenting, for these interesting topics. And hopefully we'll be waiting for the last results and last findings and to see how they were implemented and published. Thank you very much again, and we're going to end the session now.
Thank you so much and congratulations.
Thank you.